Hello, my name is Dr. Luke Rassman. I am a fellowship-trained hip and knee reconstruction specialist at the Orthopedic Institute. Today I'd like to share with you the three most common reported symptoms of hip and knee osteoarthritis. First, to the hip. The most commonly reported symptom is anterior groin pain, and typically this pain radiates to the buttock in some way. Second most common reported symptom is morning stiffness, or that sensation that it takes a few steps in the morning after you get up to get going before the joints really warm up. The third most common reported symptom is difficulty putting on shoes or socks, and this comes from the stiffness that's associated with hip arthritis. As bone spurs and other things form, the hip range of motion is reduced, and then things that require a lot of hip range of motion, like getting to your feet to put on your socks and shoes, becomes more difficult. Sometimes patients have one or all of these symptoms, which can lead us to that diagnosis and confirm it with radiographs. Next, to the knee. The number one most commonly reported symptom of knee arthritis is pain and stiffness, and especially difficulties flexing the knee or getting up from a very low seated chair. The second most common symptom is deformity, and that's typically in a varus or a bow-legged deformity of the legs, but can, in more rare cases, be a knock-kneed or a valgus orientation as well. And that tends to progress over time. Last symptom is difficulty navigating situations where your knee is going to be in a lot of flexion, like getting up from a low chair, going up a staircase, or getting in and out of a vehicle. And this becomes more difficult as there's more pain, and those high flexion situations are where you put the most amount of stress through the knee. Again, I'm Dr. Luke Rassman. I'm now available for consultation at Orthopedic Institute, Sioux Falls, in Pipestone, Minnesota, as well as Mitchell, South Dakota. Thank you for listening to me today and learning a little bit about hip and knee arthritis, and I look forward to meeting you all in person. Thank you.